Today, in our today's class, we are going to talk about once again on dementia from Wikipedia, the free encyclopedia. But especially we are going to talk about the management of dementia. But you can see here, there are 8 types of management that we can follow to remove or to reduce dementia. This is chapter number 6, 6.1, psychological and psychosocial therapies. 6.2 medications, 6.3 pain, 6.4 eating difficulties, 6.5 exercise, 6.6 assistive technology, 6.7 alternative medicine, 6.8 palliative care. But in this lesson, we are just going to focus on management and 6.1 psychological and psychosocial therapies. And we will talk about on the other 7 topics in our next classes. Until then, keep waiting and keep subscribing. So let's start reading on management of dementia. Management. There are limited treatment options for people with dementia, and most approaches focus on managing or reducing individual symptoms of dementia. There are also no known treatment options to delay the onset of dementia. Acetylcholinesterase inhibitors are often used early in the disorder course. However, benefit is generally small. More than half of people with dementia may experience psychological or behavioral symptoms, including agitation, sleep problems, aggression, and or psychosis. Treatment for these symptoms is aimed at reducing the problem, reducing the person's distress and keeping the person safe. Treatments other than medication appear to be better for agitation and aggression. Cognitive and behavioral interventions may be appropriate. Some evidence suggests that education and support for the person with dementia, as well as caregivers and family members, improves outcomes. Some studies also suggest that palliative care interventions can be used to help people with advanced dementia and their families, but research is limited. Exercise programs are beneficial with respect to activities of daily living and potentially improve dementia. The effect of therapies can be evaluated by, for example, by assessing agitation using the Cohen-Mansfield Agitation Inventory, CMAI, by assessing mood and engagement with the Minora Park Engagement Scale, MPES, and the Observed Emotion Rating Scale, ORES, or by addressing indicators for depression using the Cornell Scale for Depression in Dementia, CSDD, or a simplified version thereof. Psychological and psychosocial therapies. Main article, psychological therapies for dementia. Psychological therapies for dementia include some limited evidence for reminiscence therapy, namely some positive effects in the areas of quality of life, cognition, communication, and mood. The first 3 particularly in care home settings. Some benefit for cognitive reframing for caretakers, unclear evidence for validation therapy, and tentative evidence for mental exercise. Such as cognitive stimulation programs for people with mild to moderate dementia. Offering personally tailored activities may help reduce challenging behavior and may improve. Once again, I repeat. Offering personally tailored activities may help reduce challenging behavior and may improve quality of life. It is not clear if personally tailored activities have an impact on affect or improve for the quality of life for the caregiver. Adult daycare centers as well as special care units in nursing homes often provide specialized care for dementia patients. Daycare centers offer supervision, recreation, meals, and limited health care to participants, as well as providing respite for caregivers. In addition, home care can provide one-to-one support and care in the home, allowing for more individualized attention that is needed as the disorder progresses. Psychiatric nurses can make a distinctive contribution to people's mental health. Since dementia impairs normal communication due to changes in receptive and expressive language, as well as the ability to plan and problem solve, agitated behavior is often a form of communication for the person with dementia. Actively searching for a potential cause such as pain, physical illness, or overstimulation can be helpful in reducing agitation. Additionally, using an ABC analysis of behavior can be a useful tool for understanding behavior in people with dementia. It involves looking at the antecedents A and behavior B and consequences C associated with an event to help define the problem and prevent further incidents that may arise if the person's needs are misunderstood. The strongest evidence for non-pharmacological therapies for the management of changed behaviors in dementia is for using such approaches. Low-quality evidence suggests that regular, at least 5 sessions of music therapy may help institutionalized residents. It may reduce depressive symptoms and improve overall behavior. It may also supply a beneficial effect on emotional well-being and quality of life, as well as reduce anxiety. In 2003, the Alzheimer's Society established Singing for the Brain SFTV, a project based on plot studies. Based on pilot studies, we suggested that the activity encouraged participation and facilitated the learning of new things. The sessions combined aspects of reminiscence therapy and music. Musical and interpersonal connectedness can underscore the value of the person and improve quality of life. Some London hospitals found that using color, designs, pictures, and lights help people with dementia adjust to being at the hospital. These adjustments to the layout of the dementia wings at these hospitals helped patients by preventing confusion. Life story work as part of reminiscence therapy and video biographies have been found to address the needs of clients and their caregivers in various ways, offering the client the opportunity to leave a legacy and enhance their personhood, and also benefiting youth who participate in such work. Such interventions may be more beneficial when undertaken at a relatively earlier stage of dementia. They may also be problematic in those who have difficulties in processing past experiences. Animal-assisted therapy has been found to be helpful. Drawbacks may be that pets are not always welcomed in a communal space in the care setting. An animal may pose a risk to residents or may be perceived to be dangerous. Certain animals may also be regarded as unclean or dangerous by some cultural groups. Occupational therapy also addresses psychological and psychosocial needs of patients with dementia through improving daily occupational performance and caregivers' competence. When compensatory intervention strategies are added to their daily routine, the level of performance is enhanced and reduces the burden commonly placed on the caregivers. Occupational therapists can also work with other disciplines to create a client-centered intervention. To manage cognitive disability and coping with behavioral and psychological symptoms of dementia, combined occupational and behavioral therapies can support patients with dementia even further. Cognitive training. There is no strong evidence to suggest that cognitive training is beneficial for people with Parkinson's disease, dementia, or mild cognitive impairment. Personally tailored activities. Offering personally tailored activity sessions to people with dementia in the long-term care homes may help manage challenging behavior. I would like to repeat, personally tailored activities, offering personally tailored activity sessions to people with dementia in long-term care homes may help manage challenging behavior. So, this is the end of our lecture on the management of dementia. I do hope you have enjoyed enjoyed listening to the reading on dementia. And once again, I'd like to appreciate any comments, any likes, any criticisms from you on the quality of this class. And that's why I'd like to once again thank you very much. Thank you to subscribe to this channel.